Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Welcome back, everybody. Now we're going to talk about meds today. So impactful, so important in many areas, especially when it's medication to improve your mental situation. A lot of times you have questions. A lot of times you're not really sure in terms of how those meds can impact. Now, make it a child, and you're the parent or guardian. They can't tell you exactly how they're feeling many of the times or even verbalize it. It's just one challenge there. We're going to talk with somebody who helps with that, helps direct parents, and also works with families, children. I'm talking about her facility in Massachusetts called New Beginnings. She's our professional, actually our diamond of the decade. She's fantastic in terms of what she offers in helping us, especially when it comes to meds. Sherri and Alexandrovich is back with us. How are you doing today?
Doing really good. How about yourself, Steve?
Really good, really good. And this is
Yeah,
a
good.
this is a challenging topic because there's
Mhm.
so many different meds, especially if you start getting into ADHD, if you start getting into many of those areas right there alone, then you have
Mhm.
anti-anxiety, you have meds for depression. I'm not even sure where to start on this one today. What do you think?
So I kind of wanted to focus a little bit about specifically ADHD and medication for kiddos. And I think that the parental reluctance, rightfully so, in choosing whether or not to medicate their kiddo, what medication makes sense for their kiddo, the consistency of the medication, the
Mm,
onus of who gives the medication. I think those are all really important conversations or topics to have, and it's definitely something. So at the clinic at New Beginnings, I supervise specifically the clinicians who have the heaviest kiddo caseloads, and that's because that's more my area of expertise, and that's more where I'm certified in is treating children and adolescents and families. And so I come across a lot of scenarios where I have to role play with my providers about, really important information to give our parents in terms of what does it look like when our kid is presenting with ADHD. And I think that over the years, what's happened is ADHD has become a catch-all label for a lot of kiddos, right? If you're out of
mm,
control, if you can't sit still, if there's behavioral, I think that the schools had historically been super quick to just wanting to medicate or just pushing the kiddo or the parent towards a diagnosis of ADHD. I feel like we've done a really good job in the last couple of years, specifically of moving away from that more. And I feel like the school systems have gotten, at least back in Massachusetts or the schools that we deal with, have definitely gotten back to more making sure that they're being adequately screened for that. So I guess we should start with that, right? What is first steps? First step is getting your kid diagnosed with ADHD. Who does that? The PCP is specifically who is the key holder to getting that diagnosis. So they will do either the Conners rating scale. There's a couple of different ADHD scales that are out there. The PCP is typically the facilitator of that. They will then give the parent screening to the parent, the teacher screening to the teacher, and any of the other people that are involved. Then the PCP will do kind of the compilation of what that score looks like and will then give that diagnosis of whether it's ADD or ADHD, depending on, what the kiddo is kind of experiencing.
Can we go there for just a moment? You said the PCP
Yeah.
is the the first step in the
Hmm.
process. Not minimizing anything for anybody, just asking,
Hmm.
are they truly qualified for that?
So in Massachusetts, and I'm not sure about what the other states are, the primary care is the person, right, wrong, or indifferent, that does the diagnosis. That's
Okay.
where it stems from. Is there needs to be a person that does the screening and facilitates the screening. And to be really honest with you, I'm not really sure how it originated with the primary care or pediatrician or why it has stayed that way. but that's where it's at. We
Hmm.
do have, you can get a psychological screening from a psychologist who can treat you or diagnose you with ADHD. A psychiatrist can also be the person that diagnoses you with ADHD. Typically, more often than not, it is done by the PCP. A therapist cannot just say, you meet the criteria for ADHD, we're going to give you that diagnosis, because that's not going to hold weight when it comes to prescribing the medication. And I think that because the stimulants are such a hot topic for the prescriptive world, and they are so heavily regulated on the frequency in which it can be prescribed, who can pick it up. You have to make sure that you have a license to be able to pick it up. And so I think there's just so much stipulation around the stimulants that in my opinion, I think that the reason that they have the medical person, the facilitator of that screening, is to make sure that the medications aren't being overly prescribed or misprescribed, or the parents aren't taking them and selling them. So there
Mm,
needs to be
mm.
somebody who is making sure that the medication is being distributed the right way.
So
Does that?
yeah, I get it, and maybe it's different in other states, but I've
Mhm.
seen situations based on things I've heard, personal experience, etc., where the PCP can make that determination. But I've also heard of situations where one level past that. Now, this is I'm close with the parents. They were uh, working with the PCP to identify. It wasn't ADHD, but it was a little, some depression in a tween. Um, and the PCP said at one point, it wasn't even deep into it, verbatim here. I'm tapping out. I'm
Mhm.
tapping out. This is
Mhm.
past me.
Yep.
Done what I can do here. You gotta fly this up higher on the flagpole, if you will, in terms of
Mhm.
mental health support. And this was not an extreme case at all. This was, a child suffering a little bit of anxiety. But that PCP, and that was my eye opener when I was
Yeah.
told this story. I was like, oh, well, why are they in that
That's
role
not
anyway?
that's not uncommon. That is not uncommon. So when it comes to any medications, in certain stimulants, the PCP will be a little bit reluctant to prescribe to. But when it comes to anti-anxiety, antidepressants, mood stabilizers, more often than not, the pediatrician or the PCP will shy away from that, and they will say, I need you to go see a psychiatrist or a psychiatric nurse practitioner or somebody who is better suited to be able to regulate what that medication looks like. Here's a big difference with a stimulant. Every 30 days you need a refill. You cannot get 3 refills, you cannot get 4 refills, you get no refills. So every 30 days there's eyes and ears on that kiddo when you're on a stimulant. You have to go to the pediatrician's office, you have to pick up that prescription, you have to give a report. Now in the world of Zoom, you still need to have a Zoom check-in. There needs to be accountability when it comes to stimulants. When it comes to any of the anti-anxieties, any of the antidepressants, whether it be Celexa, Lexapro, Prozac, any of those medications, they can be prescribed in 3 6 month intervals. There's no eyes and ears on them. So I do understand from a PCP or a pediatrician perspective, shying away a little bit from that because they're not going to see them every month.
Well, that's the other part of it too. They're not speaking with them on a regular basis like a
Right.
psychiatrist and a therapist can't make that can't prescribe, but at
Hmm.
least they're still talking with them to see how we doing, how we're feeling with
Right.
that. Did the
Hmm.
medication make a difference? Did you feel anything? The
Right.
doctor's really not doing that. It's a quick question, and most visits are 11 minutes on average with
Right.
to
Hmm. Hmm.
a primary physician. That includes a hello and goodbye. So how
Right.
can you really get the full story there?
Well, and not only just that, but make ensuring that, so there's a holistic approach with that. So at new beginnings, and a lot of, and so I would caution any parent about medicating their kiddo without a therapist involved for any sort of anxiety, depression, moods regulation, any of that, right? I mean, I'm an advocate for any medication being housed also with therapy, but primarily the SSRIs, right? So the medications that need to have a buildup in your system, that needs to be more closely monitored. There are places that you can go, psychiatrists who will prescribe that just on a medication perspective. New
Mhm.
Beginnings does not. So we have a med provider. We do accept outside patients who are not treated within New Beginnings, which is rare. There are very few clinics that do that. Most people are of the philosophy you have to have an in-house therapist in order to get our medication management. We don't believe in that. However, you cannot see my med provider unless you have a therapist. And your therapist needs to be willing to work with my med provider because we do not believe in a standalone approach. We do not believe that a kiddo should be on a medication without having weekly therapy to check in because it's dangerous and it's just not a philosophy that we will do. So we're a little bit unique in that sense that we do allow people who need to see a good, prescriber as long as you're in treatment somewhere. That I need to like stress that is super, super important because you never know if a kid is going to have a side effect from that medication,
Sure.
an adverse reaction to that medication. Are they taking the medication? Are they cheeking it and spitting out? There are so many different things. Do they have two households and one parent is not giving the medication when they're going there? There are so many things that
Mm.
play or impact, or there are parents who are of the philosophy that, oh, they're old enough to take it by themselves. They don't need to have that accountability. That's not true. So, medication is so important that you have to make sure that, first of all, you trust the person that's prescribing it to your kiddo, making sure that you have an accurate diagnosis for your kiddo and the kid is getting the treatment that they deserve in order to get past it. Medication brings us down, stabilizes us so that we can then learn the coping skills that we need. Medication alone does not give us coping skills. It does not give us the tools that we need to be successful.
Take me through that journey, the way it works with you. Let's say
Okay.
in your facility, um, and it, can be different elsewhere, but just
Hmm.
love looking at that. So we
Okay.
have a child who gets therapy once a week. Now,
Hmm.
I'm going to assume here, excuse me, the therapist can't write the script. Now, a
Correct.
month goes by. Let's say the medication needs to be renewed. What happens at that point?
So, who was the original prescriber in this scenario? Was it us at New
I'm going to
Beginnings?
say yes. It was you.
Okay. So, if we have a new client that comes in, they have to be seen at least for a month in order for us to make a referral to our med provider. And here's why: because we want to make sure that we are getting an accurate assessment of the kiddo, of their presentation, of their symptomology, and it's not just parent report. And I say that with the utmost respect for the parent. It's not that I think that the parent is misrepresenting, it's that
They're
as
not
many
trained.
different.
They're not trained.
Correct. Thank you.
Yeah.
Yes. Yes. I was
I know
finding a
you're being diplomatic, but parent, we don't know. How do we know?
no.
There could be certain signs and nuances that we as parents don't pick up on because we're so
Right.
close to it, where a
Hmm.
trained professional may see little things here. It's like, yeah, duly noted and such.
Right. Well, and not only just that, but we're not just assessing whether our kiddo needs it or not. We're also assessing its entirety because we're not going to start prescribing a medication like a Prozac or a Celexa to a kiddo whose parents don't believe in medication or whose both caregivers, if they're in different homes, don't believe in medication. We're
Mm,
setting this kid for failure.
yep. Yep.
If the parents of the philosophy they're old enough to manage their own medicine, I don't want them to take it on weekends. I don't want them to take it on a school, on a vacation week, depending on the medication, right? This is a stimulant aside. If it's an SSRI, if it's a medication you take every day, you cannot intermittently take it. That is
Right.
unsafe. It's dangerous. So we take that time to not just assess the kiddo for accurate diagnosis, but also to make sure that as a family unit, medication makes sense because that's an important variable. So what we'll do is we have that 1 month where we make the assessment. The clinician then decides, yes, this kiddo needs to have a medication evaluation. We then schedule through our own internal med provider, she's absolutely amazing. We have to get their most recent physical. We need a treatment plan. We need an assessment. Because she's in-house, my providers will schedule an appointment with her and give some feedback about what presenting symptoms the kiddo's experiencing. Then she makes that determination. Then my med provider makes the determination what medication is going to make most amount of sense on a call with the kid, with the parent, because my med provider is via Zoom. And sometimes my clinicians are involved in this decision making as well. They're also part of that call in some cases. So then the medication is then prescribed. And then, Audra is her name. She will then make the decision individually. And this is not just a blanket decision, whether that kid needs a 3-day check-in, a 1-week check-in, a 2-week check-in. It really just depends on what the symptoms are and what the medication is that's being prescribed. We do not do 10-minute follow-ups. That is not how we work in our organization. Audra is never scheduled more than 2 people in an hour. That is just, I do not believe in 10-minute follow-ups. I do not believe that you can accurately assess and get a gauge as to what a kiddo is going through. Some of the other agencies, the med factories, we're not a med factory. We don't do that. It's not about quality. And it's not about quantity, it's about quality. So I'm not looking to make money off my med provider. I am looking for her to self-sustain and be able to take the time that she needs to accurately spend with that family or with that kiddo or with that adult client, whoever that may be. So she's seeing 2 of you a month, 2 of you an hour, if that. Sometimes she just sees 1 of you an hour. And then, so at New Beginnings, you have that time to really individualize what does your medication treatment look like. Then you have your follow-ups. So if you're not showing up for your therapy and you're not showing up for your med appointments, we're collaborating that internally. And we're going to let you know that you can no longer be seen at New Beginnings. It's dangerous to be giving medication without eyes and ears. It's dangerous to be having a kiddo going to school every day without knowing that there's accountability from somebody that this kid is taking his meds, or that they're not having any sort of adverse side effect from that, any suicidality, any self-harm, and they're getting the coping skills that they need in order to be successful. That's super important. So that's how New Beginnings operates, is you start with your clinician, you have your assessment, you then get referred to the med department, you have your second assessment with the med department, and then you have your follow-ups, and those decrease in frequency based on your stability.
So let's say,
does that make?
Yeah, and I just want to
Yeah,
even go a little granular. So we have a child, tween, and they're seen by your provider, a therapist, and at least a month in before anything's prescribed. At that point, would they talk to your med provider, have a session with them, and then a determination is made? Okay, yeah, that might, in a SSI, that would be a good idea. Now it's prescribed, they start. Would it be 4 weeks go by with the therapist and then another session with the med provider? Or does the therapist make the recommendation to the med provider saying, yeah, you know what, it's making a difference. I think we should go another 4 weeks, or whatever the protocol is?
no. So the therapist has their own schedule, which is weekly with their kiddo.
Yep.
The med provider has her own schedule based on her level of recommendation. We are not med providers, so it would be it would not be ethical for us to then say to the med provider, you should only see this kid once a month, once a week. That's not our determination. That's Audra's determination, and she makes that determination based on her own session with the kiddo and the parent, and depending on who the kiddo is, whether they're high risk, whether they're a discharge from a hospital, whether they've had inpatient. There's so many variables that go into it. And again, each and every one of our clients are individualized. We are not a cookie cutter agency. Not no two people are treated the same. No two people's treatment plans look the same. No two people's referrals look the same. No two people's follow-ups look the same. So Audra independently makes the decision based on her experience as a med provider, how frequently she needs to see the kiddo or the client if it's an adult.
Okay. Wow. Um, what you're saying seems like that's the way it should be, in the
Yeah.
non-professional eyes, mine, because it's not cookie cutter. Every situation is
Mhm.
different, and maybe a child requires more attention when it comes to the meds. Maybe she might
Mhm.
say, you know what, got to see him again in 3 weeks, just to want to make sure,
Right.
whatever it might be. And spot on what you said before, uh, Sherry, about the blended households. You could have one where the parents like, yeah, this is the way we should roll. Now weekend someplace else or every other week, whatever it might be, that parent might not be on board. We have a challenge here. Big challenge.
Right.
Hmm.
Right. And that's something that in supervision that we talk about. So if one of my providers comes to me and says, I've got, and this has happened more times than I can even count, right? Is the the kid goes to dad doesn't believe in medication. The kid's not taking his medication. So now if that's a stimulant, that's different. That's not something that needs to be built up in your system. And
Yeah.
that's a whole other conversation about the importance of, when should you give your kid their stimulant? How long should they be on the stimulant? Whether that's a weekend thing, a vacation thing, whatnot, right? That's different. When you're on a medication that needs to be built up in your system and you don't take it, your body starts to withdraw. If you don't titrate off of that medication appropriately and the right way, you're going to become symptomatic. You're going to get sick. You're going to have withdrawals. You're going to have flu symptoms, depending on how long you've been on the medication, what the dose of the medication is. If it's not properly titrated, all you're doing is you're this. I mean, the kid's system is all, they're
Oh,
up, they're down, they're all over the place. And now they're internally dysregulated and they don't know what to do about that. And now mom and or dad, whoever that other caretaker is angry, can't control them, they don't behave. It's because they're not taking their medication. Or the kiddo who goes to school because mom or the caretaker, whoever the caretaker may be, says, well, they're old enough to remember for themselves. So what we do in situations like that is we'll write a note and we'll have the school nurse give the medication
mm.
so that the kid's getting it consistently in the morning at the time that they're supposed to be getting it. And that's what supervision is super helpful for, is because then we can really take that individual case and find other ways to help that kid be successful. Because at the end of the day, that's our job. Our job is to help everybody be the best version of themselves and be the most successful that they can be. And if that means we find outside factors to help manage your medication, then that's exactly what we'll do.
I love your attention to detail. I really do. It's so important. It's and you
So
look at it from
important.
all different angles, and especially when it's a child or a teen, that they don't know why they're feeling this way. Number one. Number two, now if meds aren't being administered on the back end, the family end, the
Mhm.
script with all good intentions, script is written and there it is. But if that's not the case, especially with those types of meds, like what a roller coaster that kid is on. Oof.
Right.
Wow.
And I have older, you know, um, early 20s who struggle with remembering their medication. So we spend large portions of our session trying to figure out how to get organized. How do we set timers in our phone? How do we do it on a calendar? Do we do a pill case? I
Sure.
mean, figuring out the best way to be successful in taking your medication is so important. And then to have that the client knowing they've got a safe place to come and say, I forgot my medication, it's been a week, I'm really sorry, I've been off, and not feel like they're afraid to come, right? So we always have to make sure that as therapists we are meeting the client where they're at. We are open-minded and we are always giving them the support and the guidance that they need, because that's okay. It's okay that you forgot your meds for a few days and then decided, oh, this point, I don't even want to take them anymore because now you've plummeted because you're either you're bipolar and now you're in one of your manias and you don't need it, or you've plummeted into depression and you're too depressed to take it, or you're too anxious to take it. And that's worth it. And that is why that wrap approach, that holistic approach is so important, because now you're not just the med provider who's seeing you once a month or every 2 weeks. You've got eyes and ears on you weekly, someone that you've built a therapeutic relationship with, that you can come in and say, I'm sorry, I forgot it this week. Or, you know what, I can't stay consistent. I don't know what to do about that. Well, then either we either come off of it the right way, or we find other ways of dealing with it. And that's why I will never allow anybody to get medication without therapy at New Beginnings. It is against our policy. It's not something that I would ever allow to happen.
Can't imagine. I really can't.
It feels unsafe, right? Because there are so many places that you can go in Worcester and you can walk in and you can say, oh, I would like this, and you're going to walk out with that script. New Beginnings isn't that agency.
Well, I love it. The way you position it there, where it all funnels into one person who is aware of everything.
Yeah, the gatekeeper.
You know? The gatekeeper, thank you.
The gatekeeper, absolutely, who has to be aware of all the variables. And sometimes that's hard to do. When you're a clinician and you've got 35 kids that you're seeing a week, sometimes it can be really challenging. And that's why supervision is so important, because you can bounce ideas off of somebody and get a different perspective, or look at it from a different angle. And that's why we at New Beginnings, weekly supervision, that's what you're going to get. I mean, or every other week, depending on, where you're at in your caseload, or what the need is. But it's important to have eyes and ears always checking in. Med provider doesn't work alone. Clinicians don't work alone. Supervisors don't work alone. We all work collaboratively together, because somebody else is always going to look at it from a different perspective. And why not be open to that? Why not be open to hearing all the different ways that collaboratively, I mean, you have a team at New Beginnings who's going to give you every different perspective imaginable, from a substance abuse perspective, from a child perspective, from an adult perspective, based on whatever everybody's specialty is. And you've got a melting pot where we're going to be able to give you the best advice moving forward to help you, because that's what we want. We want everybody to be able to get the help that they need to be successful.
Starts with a conversation. This is very individualized and personal. newbeginningswc.com. Certainly you're in Massachusetts, but you can work with others depending on the situation virtually. Yes. Great conversation today, Sherri. Just so important. And so many different angles here. So families have different beliefs. There's a lot going on here. But ultimately, you want your child to be stable and doing well. Thank you again. Happy New Year, by the way.
Oh, Happy New Year to you as well. 2026 is going to be amazing. I feel it in my soul.
Feeling the same thing.
Yeah.
I appreciate what you and your staff do, and looking forward to talking next year. There, I said it.
All right. Thank you. That sounds wonderful. All right. Happy New Year, everyone.
We'll be right back.
Bye-bye.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.